County. We'll give you a brief update from the Emergency Operations Center here in Grant County. We still are meeting daily. We collaborate with the health department every day. We look at the numbers, try to figure out what our programs are working and where we need to change things. So we reassess daily. With that, and I just want to take some time to thank the entire crew that's been with us in the EOC. The entire team meets once a week at this point, but we meet separately every day. Some of us are meeting every day. So, but the team is held together through all of this, and it's been great. So that has taken a lot of pressure off any individual and has spread it around. So we truly have a great team working very well. So I just want kudos to them.
You really do. And last week, Commissioner Bardsley was faithful to share with us that we were then 168 days into this. Do you have today's count?
I don't. Commissioner Bardsley caught me off guard.
Well, over 168 for
yes,
sure.
it's we count them still, but yeah, it's one of the numbers out there. Mm-hmm. So really some of the things we're looking at and today's numbers, speaking of numbers, we are experiencing a bit of a spike. So the numbers are up. Dr. Moore will probably talk more to that, but we're constantly trying to figure out why and where that comes from. So some things I can tell you, meeting yesterday morning with the manufacturers in Grant County with Tim Eckerly and the Economic Growth Council. I'm really glad to report that incidences that we've been able to track back to the workplace, in manufacturing anyway, are very, very low. So the manufacturing segment of society is doing very well. But they have a really good opportunity to clean between shifts, wear the proper PPE, and they can enforce that in their buildings, and it pays off. Mm-hmm. So we looked at really employment as a whole across Grant County, taking out healthcare workers. We know that they would skew the numbers a little bit, and even with the schools, which have not been bad. But so we're trying to keep an eye on it and look for the positives, so we know what's working, so we know what to do in the future. So, but we'll continue that as well. But the numbers are up across the 7-day. We've had 79 new cases reported in the last 7 days, which runs about 11 new cases reported daily. We look at that on the 7-day, and we also look on the 14-day just to keep track. And they're up as well with 139 and about 9.9 cases a day, so 10 cases a day for the past 14 days. That is neither steady nor where we want to be. So both of them things concern us a little bit, and Dr. Moore, I'm sure, will speak more to that and hospitalizations and other things. But if it was at least steady and high, that's one thing. But when it's neither steady nor high, we're a little concerned, particularly going into a holiday weekend. We just want to continue to urge the wearing of masks, protect yourself. I just recommend that you not attend big gatherings. We know that those are breeding grounds, those are spreading areas, and so caution looking into the weekend. Make sure that do whatever you can to avoid that whenever possible.
Good words of wisdom.
Sure.
I know that you have shared in the past that whenever we have seen a spike, that up to this point you have been able to identify it as being linked to a large gathering of some sort in which the protective equipment was maybe not well used. Is that something you're still investigating to see if you can ID the reason behind the spike?
This spike concerns us a little bit more because we cannot trace it back to a couple of events. So really widespread across the county. And it takes us a couple of days. The health department has to work through the numbers, and we're always a few days behind as the cases come through. And the information that the contact tracing that happens at the state now gets filtered back to us, where we have time to take a look at it. So at this point, we cannot pinpoint a couple of areas, but we will continue to work on that. We will.
Okay.
We'll get there. Just a couple other things before I end. September is National Preparedness Month, so we will have more coming. We want to spend this month and try to get out more information to the folks, but it's a good time to review your plans, whether it be fire, flood, weather-related stuff, earthquake, anything that could affect your family, your home, your business. September is the month to work on those plans. And we'll be putting out some more information where you can go and look at kits to get and what should be in your kit, first aid kits, list of family contacts, those kind of things. So we'll continue to work through that this month and focus on preparedness. Okay.
Very good.
Thank you so much for the opportunity to spread that word too.
Thank you, Bob. We appreciate you coming on and updating us.
Thank you.
And as we bring Grant County Commissioner Mark Bardsley on, I just want to encourage everybody, hey, as he's mentioning National Preparedness Month, you can be proactive. Make sure you've got those extra fresh spare batteries for those flashlights. Make sure that those smoke detectors have fresh batteries and are functioning properly. Just take a little time just to go through that checklist in your head and make sure that you've got your bases covered. All right, well, I would like to welcome Commissioner Bardsley to the update today. Welcome, and what would you like to share with us?
Well, thank you, Angela. It's always good to be with you, and we appreciate this station helping us. And I don't take it for granted that when we say thank you to our media partners for getting this information out, we really do appreciate this opportunity. As already kind of been mentioned, when it comes to our cases in Grant County, we're at just under 1,993 cases from the beginning of this pandemic, and as mentioned, 31 deaths are part of our statistics. The mask mandate has been continued by the governor, and that will go at least through September 27th. Please be reminded of that. The more we are out in public and in gatherings where there can be cross-contamination, we want to make sure that we do our very best to cover up for our protection as well as those around us. We want to encourage you. The state of emergency will continue through October 2nd, and again, the governor will be reviewing those items, and we'll see if we have to extend that state of emergency further on into October or November. I can report to you that last week there was a public meeting for vote centers, and that was at College Wesleyan Church. They did have some interaction with the community, some questions that were asked, and the committee met just yesterday and recommended to the election board to move forward with voting centers, and we're happy to say that the election board did approve that, and so we're moving toward the fall election with 11 different voting centers where any voter in Grant County can vote at any one of those, and we're excited about that. We think it's going to help us move along the election process, and so we're working with Pam Harris and Nancy Bryant out of the election office to do that. I kind of want to follow a little different pattern today because this week there has been a dump of information, data that's been coming to us. And I just want to make sure that we're kind of on the right frequency, we're on the same page. And I like to listen to a particular preacher. And if I go to Moody Bible Radio at a certain time, at a certain station, I can listen to that guy and I get I'm on the right time, the right channel, I get the right information, and I get the right message. And I want to make sure that we have the right message about what is going on. Monday, the CDC did release death certificate data for approximately 160,000 of the 180+ thousand deaths that have occurred thus far attributed to COVID. Now, when coroners and health professionals fill out death certificates, the list of the main cause of death and contributing factors are listed. That being said, a certificate can have multiple causes and or a string of causes that tell us the manner of death, ultimately. I don't know if you remember, but at one point I was the coroner in Grant County, and so if I were to sign off on a death certificate saying that somebody had blood clots in the lungs, I would still need to know what the cause was of those clots. It could be that that person was susceptible, and because of their cholesterol levels, because of other things, they could throw clots, or they could have been in a traffic accident and therefore have blunt force trauma, and because of the accident that had the blunt force trauma, then they had blood clots as a complication and died for that reason. So things like diabetes, high blood pressure, obesity are factors as people are infected with COVID. with COVID-19 and having these pre-existing issues, COVID becomes the catalyst to spur on the current disease. And that disease is not necessarily a fatal problem. You can have diabetes, you can have COPD, you can have risk issues, health risk issues, and still not die because of those issues. And so we need to make sure that as we understand these data information bits that are coming out, as a catalyst, problems like respiratory failure, respiratory arrest, cardiac arrest, heart failure, adult respiratory distress syndrome are happening with people that get this COVID-19. So in the released data, it says that 6%, or just about 10,000 people on their death certificates actually had no other factors except COVID-19. So interpretations really are all over the place on this data. But if you understand that you can die of a COVID-related issue because of diabetes or because of the respiratory failure or these things, COVID is the catalyst that has attacked that weaker immune system problem in a person's body. Therefore, we have to make sure that the people that are reporting the information don't have a personal agenda or don't have a political agenda. We're dealing with science, and what I hope that Dr. Moore can reaffirm what I'm saying is that people die with COVID, but COVID may not be the only thing that is a part of that death process. So when I was a pastor many years ago, I had a gentleman that loved to, he would use scripture and say, "Come, let us reason together, says the Lord." And the rest of that says in Isaiah chapter 1, verse 18, "Come, let us reason together, says the Lord. Though your sins are like scarlet, they shall be white as snow. Though they are red like crimson, they shall be white as wool." Now, we have, of course, the spiritual implication, and that is, there's no question about that. But as well as we reason together, as people discussing data, discussing things that are going on, we need to make sure we're on the same page and understand the things that are coming to us so that we as a community can then, in fact, protect one another, protect ourselves, and continue to get through this long process. So physically, I think that we are talking about not only discussing with one another, but understanding what the problem is and how we attack it. We attack it with masks. We attack it with physical distancing. We attack it with personal hygiene. I think that's why we've stayed so low in our community up until this time. Now we're seeing more people interact again. We're going to see things go up. Just be prepared. And as always, we thank you for your time. Be safe, be steady, and be strong. Appreciate it, Angela.
Thank you, Commissioner Barger. We appreciate those insights that you shared with us. And to continue on with those insights, we're going to invite Dr. David Moore from the Grant County Health Department to continue those thoughts. Welcome, sir. Thank you for joining us.
Thank you. It's a pleasure to be here. Thank you for inviting me.
So as he was just sharing with us, those underlying pre-existing health conditions, those do play a factor in some of those numbers that we see being released on a national scale. Can you provide any further insight on that?
Just that everybody who lives long enough has things that medically go on and may make you vulnerable, but with proper self-care and with modern medical care can live on and on and on. 80, 90 years old is very common. You take somebody who has those conditions and you add COVID on top of that, and you get somebody dying in a way that is premature. So that the people who are there who feel like, I'm young, I'm healthy, it's not going to kill me. It's not that it can kill you, but it's not likely to. It's that as part of a member of a bigger community, that taking care of yourself, being careful about spreading COVID to other people is a responsibility that we have as a community. It's a part of us taking care of one another. It's that saying that you may see as you drive along the road in some businesses, that we're all in this together and that we're here to take care of one another. So yes, that is a factor. As we look at those, there are some pure people who got it, who had nothing going on. They got sick and may have died. There are a lot more who got it, who through the course of living would have lived on and still be here today, who are no longer with us because they did have that was there.
Do you have any insight that you can provide to us with regards to the spike, the recent increase in cases that Bob Jackson was mentioning just earlier? I know you have been a big fan of testing and trying to understand the method behind how this virus works.
Yeah. Yes, thank you. So often up until now, there's been an event and we can see it. We could anticipate that as summer came and that as people were getting out and traveling more and going on vacation spots, that they may go to places and then bring things back here. That's probably one of the ones. An important one is that people, because we have done so well in Grant County, have gotten to the point that they feel like this is no big deal, particularly the people who are most likely to spread it and not necessarily get it. The younger people who bring it back home and give it to more vulnerable people. That we've seen much more of that, of the gatherings that we see. And we can gather together, we can do it safely if we do it thoughtfully and if we do it wisely. That masking up and knowing that this is primarily a droplet spread. It can be spread by vapors that float in the air. It's primarily droplet spread. And if we protect ourselves and protect one another, I wear this mask as much to protect you as I do to protect me. It's part of my social responsibility. And that we're starting, all of us are tired of this. 175 days if Bob didn't count for you.
You've been counting,
yes.
yes.
That we've been meeting in Grant County to prepare to deal with this. And all of us are tired of it. It just is wearing. But the virus doesn't go away because we're tired of it. And our need to take care of one another doesn't go away. We are developing more treatments and other things. But the most important two things that we can do is social distancing in order to allow the droplets to spread and reduce that by wearing a mask. Masks make a difference. The testing is, this disease is primarily scary because we don't know where it is. And we don't know where it is, in my opinion, because of the lack of testing. And the more we can test, the more we can test. That is the contact tracing. So when a test is done, that you know the results, and the people who've been around somebody who tests positive, we can identify those. And before they asymptomatically spread it to the next person, we can do that. Well, the test may at Optum ready in 24 to 48 hours, and then it came 48 to 72 hours. But there's help that's on the way. The hospital has what they call point of care testing, so that at the bedside, at the time that it is done, results can be made available. The federal government has bought up, is distributing to the states, and eventually will be distributing to the communities these point of care testing. Our ability to know that that cough is something that's significant. Not that you're going home and you're going to be there for 3 days and all of the people in your household are going to be, but is this something that's significant? And in my mind, one of the most critical elements of our taking care of this is let's find out where this virus is. And that means all of this, symptomatic or not symptomatic, if you've been in a high-risk situation, find out your status and know, are you safe to go visit grandma? Is it safe for others to come inside of you because you've tested and you know your status, especially if you have symptoms? And we're going to have that available to us. And go ahead, I'm sorry.
Do you anticipate, I've seen some news reports where they're working on making self-tests available that we can purchase in the marketplace. Do you have any information on whether or not those tests are a reality yet, or if we're going to be able to get a hold of those?
Those are a reality. They're not widely available, but they will be available for us also. All of these are available on an emergency use authorization. That is, they have not had the widespread extensive testing. We've mentioned this before, that many of our other tests have been tested for years extensively, and when the stamp of approval by the FDA or the CDC has given to them, it's because they've got that We don't have that for these tests, but we have reason to believe that they're reasonably effective and safe, and they won't be misleading by giving false negative or false positive results. And the saliva test, the home test, is going to be one of those things that we're going to be able to add to that armamentarium so that it won't be a mystery disease as much as it is. It still can be a deadly disease, but it won't be a mystery disease. And I want to add to what Bob and what the commissioner was saying also, with the holiday coming up and with all of us being sick and tired of this 175 days here, but longer for many of us who've been hearing about this disease there, that it's there, but it doesn't change. We still need to, until and unless we have the vaccine, to do social distancing and to wear a mask, to do hand sanitizing, and to be conscious and aware that we're going to get through this, but we're not there yet. But if we stay there together, we can get through this together to a healthy place. Our kids are back in school. Our school teachers, superintendents, school nurses, health departments are working overtime. We're getting better and better direction from the state, and it changes. 1 week it may be one thing, and as we learn new things, it may be another thing, but we're getting better and better direction from the state on this. We can get through this, but let's not get careless. Let's not let our guard down with that.
Good words of caution. Dr. Moore, we thank you so much. Always appreciate you coming in and sharing your expertise with us.
Thank you. It's a pleasure to be here.
Thank you.
Angela. And thanks to the entire team that's working on this.
Yes. And as we invite Superintendent Dr. Brad Lindsay from Marion Community Schools on to share, I'd like to insert a little side note here. We had Commissioner Bardsley talking about voting, and the city of Marion has a bus service that is offering call ahead service. So if you would like to go and vote, they want you to call them 24 hours in advance, but you can schedule a pickup and they'll take you to one of the voting centers, or if you would like to go down to the courthouse and vote. And the number, and I'll make sure to share this with you again later in the update, but it is a local number, 765-668-4445. So 765-668-4445. And you can schedule your pickup to go vote. And now, Dr. Lindsay from Marion Community Schools, thank you so much for joining us today. What giant news do you have to share with us?
Thank you, Angela. You make me smile. Hey, Angela, I continue to get older, and that's another way of saying I continue to get more experienced. But in my 30-plus years overall in education, and in my 8th year here at Marion Community Schools, this is the best start, the first 4 weeks of school that I have ever experienced. And here's what I mean by that. It is the most peaceful, purposeful, and productive learning environment for our students and our families that I've ever experienced. Everyone doing protocols and aligning to what's asked of them. I'm so thankful for all that. And my phone is ringing right here, and it took me off my notes.
But that peaceful and that productive, that just shows the planning that was done over the course since, March, April timeframe, over the course of summer. You had that strategy, you had that planning that you put in place, and now you're implementing it, and you're seeing that there's good fruit from that effort.
There's excellent fruit. Thank you. It's kind of like hard work over time, do the right things in the right ways, and you begin to reap the harvest. But we do know that peace and purpose precedes productivity. And productivity is what we're seeing. And it's an environment where there's an acceleration of achievement, acceleration of academics that we're experiencing. And I just want to thank, it takes a whole team and a whole community. So I want to thank the giant nation. I want to thank the community of Marion. I want to thank all of our teachers and staff and principals, administrators. But I want to thank our students and families. And the key, our children are our future. So the strong foundation that's so important is our preschool through 4th grade, or Marion Community Schools, our 4 elementary buildings. And I'm telling you, our foundation has never been stronger at Riverview and Kendall and Allen and Francis Slocum. And I'm excited for you to hear right now from a true Marion giant. She is an outstanding leader, an outstanding principal, and an outstanding community member, Ashley Dixon, the principal of Riverview Elementary, that overlooks the beautiful river and river walk near the Matter Park.
They do have a really beautiful view. Well, as we bring Principal Dixon on, I'm excited to hear from her, as I'm sure you are, because I think we would all like to hear with the new protocols and the adjustments that students have had to make, and some of our younger giants as they are in that pre-K up to 4th grade age range. How are they adapting? So, Principal Dixon, welcome to the update. And can you share with us some insights as to how students and families and faculty are making adjustments and working through the challenges presented this school season?
Yes, so I think Dr. Lindsay was talking about we're seeing the reward from all the hard work over the summer. So even when we shut down last year for quarantine, we never stopped. Teachers never stopped. Our staff at Riverview, our whole staff at Marion Community Schools never stopped. We were working to benefit when we did get to go back. And now that we're back, it's just been great. It's been a lot of work and a lot of new trial and error, seeing what works, but seeing the happiness of our kids and seeing all of our parents, it made it all worth it. So we're doing lots of different things to make sure that everyone is safe. Masks, these are one of the things. Our kiddos are doing such a great job. We thought it might be a struggle, but parents are doing a great job sending their kids with a mask. If they don't have a mask, we do have them available. And so we always pass out those extras, which kind of comes around with our community members. They have done such a great job helping out the schools, bringing in donations, not only school supplies, but now they've brought in quite a few masks for our kiddos who haven't been able to supply them.
I think that there was a concern early on with some of the younger children, which is exactly the age range that you're working with at Riverview Elementary School, that some of the younger students might have an aversion to wearing the mask, or there might be that whole fear or intimidation factor of being surrounded by adults and caregivers and whatnot that are masked. Are you seeing any indication that there is a problem with that, or are the children pretty comfortable with it?
The children have done such an amazing job, above and beyond what I ever expected, and I think what anyone, like you're saying, would have expected. We have actually come up with a system to where each student, they have a lanyard and they have their mask on their lanyard. So when they are appropriately spaced, they can be without their mask. But then we also have masks for our teachers that have plastic around it to where the students are able to see their mouth moving when they're talking and to make them feel a little bit more safe. So overall, everyone, staff and especially students, have been doing a great job. We haven't really had much trouble at all with students. They just pick up, they see what the adults are doing. And so we have great role models at Riverview and all the elementary schools, so they follow suit.
So they're mirroring what they're saying. Well, I'm curious then, one of the things that Marion Community Schools has been a leader in that is home schooling, if you will. The Giant Online Learning Academy, that is something that there's a large number of students participating in. And I'm curious, on the pre-K to 4th grade level, how many students have you seen participate in the Giant Online Academy versus on-site location learning?
So at Marion Community Schools, we want all of our families to feel comfortable. And we know that comfortable for everyone right now isn't back in school. Although we want all of them to come back because we miss them, we have offered a Giant Online Academy, which is still tied into whatever homeschool they're in. And we've seen it. We started off with about 35% of students signed up for our Giant Online Academy. And since the beginning of the year, we've had about 25 students come back. So now we're going between 25 and 30% of our students. We have a system kind of when they feel comfortable to come back, they give us a call and we talk it and we work it out to where they can come back on site. We want to reach them where they're at and where they're comfortable, but we also want them to come back because we know that we can provide them the most while they are there with that full day.
So I'm curious, what are some of the other exciting things that are happening at Riverview? Maybe not so much COVID related, because I know there's a lot of neat things happening within Marion Community Schools.
So starting off this year, we have had a lot of planning, and it's a little bit different because with different regulations due to the COVID, we can't do some of the things that we really enjoyed doing. For example, some of our things like family night, our community day where we bring our whole school into the gym together to celebrate each month. But what is really exciting is now we're coming up with all new ways to be able to celebrate our successes as a school and as a district. So this month we'll have our very first virtual community day where everyone in the school will participate in their own classroom, but we'll be able to share it live. And then we'll also, Riverview is kind of famous. We do a walk of fame every month. So students who get good office referrals and good phone calls home for doing outstanding giant things. Now we're going to take their picture and they're going to get to be in a virtual walk of fame, and we'll be able to publish that on Facebook so parents can follow along and see too. So we're really excited about that. That way we get to honor our students of the month still, and we still get to reward our students for doing those giant things. Just a little bit different so we can take the precautions to be safe, to make sure they're all safe. We also are getting creative with our PTO group. We call it our PASS group, Parent Allies for Student Success. We're coming up with creative ideas because we can't have, people coming in the building. We can't have large gatherings, but we can still do different things to support our teachers and to support our students. One of the ideas unfortunately, we had to cancel our spring fling. And so we have donations that were made, for example, an American Girl doll, some Lego sets. And so we're going to do a silent auction through our Facebook page to raise money for our students and for our school so that we can do some more of these fun things. We're also getting ready to start a shirt fundraiser where students are going to design some shirts and people are going to vote on them so we can create some more giant gear.
How are they going to find, if anybody's interested in purchasing the shirts, or maybe they want to participate in that silent auction online, how would they go about finding you?
So the silent auction is going to be online through our Riverview Facebook page. So you can just search on Facebook, Riverview Elementary School. We will also be sending flyers home with the students. So if you do have a student at Riverview, be looking in their homework folders, those things being sent home. And then, of course, you can always reach out to Riverview's office.
Well, I have about a minute left here. Is there anything else that we need to touch base on regarding Riverview Elementary School or elementary school pre-K as a whole through Marion Community Schools?
I just want to thank you for letting me be here and share some of the good news. Pre-K to fourth grade, all of Marion Community Schools, all 4 of the elementaries have done such an amazing job welcoming back their students and keeping them safe and being that safe haven for students and for families. So I'm just thankful to be part of a great team that's able to do that for all of our students and all of our families, and we want to continue to do that. So thank you.
You're welcome. Thank you, Principal Dixon, for coming in and sharing that perspective with us for the pre-K to fourth grade. I know a lot of folks really appreciate being able to hear from your vantage point, so we appreciate that. And I would like to remind you that today's broadcast will be re-aired here on WSOT-TV at 5:30 p.m. and again at 10:30 p.m. and additionally on Sunday, September the 6th at 10 a.m. and 5:30 p.m. Thank you to the Chronicle Tribune, the News Herald, WBAT, and the many other local media outlets that are helping to communicate this update information to you. And again, one more time, as I promised, if you have your pens ready, the phone number for the City of Marion bus service that you can call ahead, just give them a 24-hour notice, and they will schedule to come pick you up and take you to a voting center or down to the courthouse if you would like to absentee vote somehow. The number that you want to call, it's local, 765-668-4445. And again, that number is 765-668-4445. And that's all the time that we have today. Thank you so much for joining us. Stay tuned for some more quality family programs that you can trust right here on Sunnycrest Outreach Television.